Go for it.
Right. Good evening. I'd like to welcome everybody this evening to Grand River and our special presenter, Mason Hohstadt of Garfield County Public Health. Mason is also the chair of the Suicide Prevention Council of Garfield County, and we're very honored to invite him here to talk about suicide prevention in our community.
All right. Thank you so much for having me tonight. I am a trained presenter for the Colorado chapter of the American Foundation for Suicide Prevention. I'm glad that you all joined me tonight for this presentation on suicide prevention. So just before we get started, I just want to really remind everyone that this is not in lieu of mental health services. Suicide can be a sensitive topic to discuss. So if you are having issues, please let us know. We can find somebody for you to talk to. If this information is something that brings things up for you, that's okay. We'll try and figure out the best way to get you the help that you need. But this really is a peer-to-peer program. And what that really means is that this is meant for you to take into your everyday life. So when you talk to your friends or your children or spouse, family members, it's really meant to give you some guidance and ways for you to communicate with the people in your lives. So AFSP stands for the American Foundation for Suicide Prevention. Has a mission to save lives and bring hope for those affected by suicide. You do that through 5 core strategies. Education, which is what we're doing today. Public awareness. So we have an Out of the Darkness walk that happens the last Saturday of September. Will be September 28th this year. Advocacy. So working on public policy issues. March 20th is Suicide Awareness and Prevention Day at the Capitol this year. Outreach and support. We do have a trained individual in Garfield County to offer healing conversations. It is another peer-to-peer program. If someone was lost, someone into suicide, and so that is a different understanding of grief and loss. That doesn't necessarily. It's better to talk to somebody who has lost someone to suicide, and hear yourself have lost someone to suicide, and then finally research. And we'll talk really, what research has really given us in terms of understanding suicide and suicidality. So when we start, this is a statistic that probably maybe some of you know, some of you probably may not. And it can be scary, right? When we hear that the individuals, 90% of individuals who die by suicide have a known mental health diagnosis. But we need to kind of take a step back and realize that doesn't mean that every person who has a mental health challenge or issue even considers suicide. 1 in 4 people in the United States will have a mental health issue or challenge. That is about 83 million people. So when we think about that, out of the 330 million people that live in the United States. So, but what we really do know is that there is a definite connection between someone's mental health and their risk of suicidality. So we also understand more now that we need to build a more holistic and well-rounded approach to suicide prevention. We need to have some universal education and health promotion. So really giving people, starting as young as, elementary school, understanding of what their mental health is, giving kids the ability to regulate their emotions and build some resiliency. Then really informing our healthcare systems and our workplaces that mental health is a part of someone's health. So it should be considered when we are thinking about things like the sick leave policies. When we have conversations like this, what we're really trying to do is change the social norms and to reduce stigma and encourage people to really seek help, right? You can't necessarily... mental health treatment is one of the best ways for us to prevent suicides. And then we need definite changes in public policy in terms of funding and information. So what we're going to learn today, we're going to really be able to describe the impact of suicide. We'll identify contributors for specific populations and protective factors. We will describe how to recognize suicide warning signs, provide examples of how to start conversation, which is really important for us as lay people. We know our friends and family best. We can tell when there are moments of struggle, and it's really important for us to be one of the front lines of getting this information and being able to help our community. And that we're going to list some ways to offer support and crisis resources. So before we really start, we really need to start thinking about the ways in which we talk about suicide. We need to start using more concrete language. And what I mean by that is that we want to avoid saying things like committed suicide. And the reason for that is because it has both positive and negative connotations. In the past, suicide was a crime. You could be charged with a crime for attempting to end your life. And so also other people committed a crime, they committed theft, and so that's a negative connotation. But it also can be a positive, right? I'm committed to my faith. I'm committed to my job, to my family. So we want to use those concrete words. Someone has died by suicide. Someone has attempted suicide. And the reason for that is because when we use concrete language, it takes away some of the stigma and allows for us to have an actual honest conversation about what has happened. So other common terms that we want to make sure that we know is a suicide loss survivor. That would be somebody who has lost someone in their life to suicide. Bereaved to suicide, the actual act of mourning someone who was died by suicide. And then a suicide attempt survivor. But no, I missed the other big one. We don't want to say failed or successful suicide attempt. The successful suicide attempt would be the fatality, right? And then the other time when we're talking about someone who is in crisis and has been dealing with this anguish and pain for so long, and then they have failed at the last act they thought would be important, it just isn't a good way for us to think about that. And so the bottom there would be, to talk about someone, or the language would be suicide attempt survivor. So suicide is a leading cause of death in the United States. It was in the top 10 for a while. And then it has been pushed down due to COVID-19. But now that there have been rate reductions in COVID-19 deaths, I suspect that for 2024, that suicide might come back into the top 10 living causes of death. Darren?
How is that?
What do you mean?
Like during COVID-19, it was down. You think the people were with their families or?
I do think that. I think we saw in Garfield County, a 42% decrease between 2019 and 2020 in suicide deaths, and that the number stayed the same in 2021. And I do think that suicide is a very private act, and we didn't have a lot of privacy in 2020. We also had lots of people checking in on us. There was lots. Who have you talked to this week? Did you call that person? Did you check in with them? And also, I think people were able to have their basic needs met. We had lots of the extended or whatever unemployment, as well as people. The Paycheck Protection Act and all of that was, keeping people able to support themselves and their families. But really the big one, I think, is that people were really touching it on each other. And we did have a lot of cracks in that for a very correct act. But as we were talking about before, millions of people think about suicide every year. And then every year, about 1 million people survive a suicide attempt in the United States. And of those, 90% will go on and will not attempt again, and will survive and thrive. And most of the time, that is, the length that they needed to be able to access mental health services, right? And as we here in our small little valleys know, we've all been somewhat impacted or affected by suicide. But we know that there are differences in suicide rates. Men have 3 times the higher rate of suicide death than women. I think, there was an old myth back in the day that women attempted suicide more often than men. I think that myth was born out of some truth, but that's because men choose the most lethal means the first time. And that goes with this. Suicide rates are 3 times higher in homes that have a firearm. Men are more likely to choose a firearm. 81% of firearm suicide deaths in Garfield County are men. So when we think about this in a larger context, that's what that really gets to. Veterans, obviously, we have, you can't really, ever since I can remember being part of this work, veterans have a, special population for crisis services. And you're definitely middle and older adults. 51% of our suicide deaths in Garfield County occur in people between 30 and 59. But what has routinely been a predominantly male, white, middle-aged, working age type of event has now become something a little more, has gone into our minority populations, youth. Youth still we still see more youth attempt hospitalizations than we do other adults. But youth suicide deaths have been increasing. Same thing with other minority populations. So I thought about skipping this, but I'm not. So the suicide rates are highest among these industries. So this goes kind of back to what we were talking about in terms of statistics, and the statistic of 90% of individuals die by suicide have a mental health condition. Well, as you can see, the industry that has the highest is mining, quarrying, and oil and gas excavation. That doesn't necessarily mean that they have the highest numbers. It just means that we're starting with a smaller pool of people. So 1 death out of 100 is more impactful in terms of a rate than 1 out of 1,000 or 40 out of 100,000. But what's really interesting, if you look at all of these, is that all of these are pretty much manual labor jobs. And so we have issues with things like chronic pain, work job instability, and I lost my train of thought from that. Sorry. But yeah, so the biggest thing is the manual labor, and and chronic pain and other issues. But as you can see, although arts, design, entertainment, sports, most of the jobs that have the highest rates of suicide deaths are definitely those manual labor positions. So this, we have every single person has interacting risks and protective factors. And what does that? So we all have within us things that make us higher risk, or have a risk for suicidality. But we also have those things that are protective factors. So these 3 things in the back, these things are always going on in the background, right? So biological factors, that would be the pain that's associated, if you have a chronic condition. Psychological factors, having depression, ADHD, anxiety. And then the social and environmental factors, right? Are when we were talking about being able to take care of one's family, are you able to do that? Environmental factors, do you have a firearm in the home? And then we get to this current life event or stressor. There usually is everyone who, family or friend dies by suicide, and everybody wants to look for the reason or the cause. There's not one cause, because we all have these things going on in the background, but usually there is another life event that occurs where somebody starts the ball rolling, and then they acquire lethal means and make their way to suicide. So this just kind of gives more ideas of what are those things going on in the background. So, we have resilience. This is an individual protective factor. And can somebody rise above the issues that are happening in their lives? But now we have family history. So family history, we know that if a parent, a child dies by suicide, their risk of dying by suicide actually increases. But we also have things like head trauma. Head trauma is a big one that we are just now really researching. Why does somebody who has that has had head trauma, who has never had any suicidal ideation before the head trauma, all of a sudden it turned away? But social skills can be a protective factor. Access to care, protective factor. And this is a big one, willingness to access care. Especially in the hospital setting, if someone's not willing to be part of their care, their treatment, that is probably not going to go. And then we get to that current life events and stressors, and then acquiring the lethal means, and then suicide. So this just kind of gives more contributors to the suicidal behavior. A big one is previous suicidal behavior. As I said, although, 1 million people every year survive a suicide attempt, the more times that an individual attempts suicide, the more likely that they are to die and have a fatality. Mental health conditions, but again, just because someone has depression or bipolar or psychosis doesn't necessarily, it's not inherent that they are on the path to suicidality. I myself, when I talk about it, I have severe anxiety disorder, social anxiety disorder, severe social anxiety disorder. Doesn't necessarily mean that I can't get up in front of people and give a presentation. It manifests in other ways. I have moderate depression and generalized anxiety, and then ADHD. Still, but I'm one of those people who has never thought about suicide. Physical health conditions, chronic pain. When it comes to pain, we really have to think about hope, right? Everybody wants to live and have hope for the next day that comes up. And if you are waking up in the morning to the same pain that you had yesterday, and it's not getting better, and there isn't anything that anybody can do, that is a risk factor, and we should think about that. Family history, mental illness, suicide loss, ACEs, adverse childhood experiences are a risk factor. We talked about traumatic brain injury, genetics, and then social factors. Race or gender-related discrimination, prejudice, systemic racism that has stored the time. But we all have protective factors like we were talking about. So these first two are really individual. If I can see the resilience, the idea that there is blue sky, but it's just being the gray clouds are not allowing me to see it. I can figure out that the gray clouds are going to pass. Then strong sense of a personal identity. Like, I know who I am. I know how strong I am. I have been through some things. I can get over this part of Dollyton. Social and problem solving skills. So these X are kind of our communities. So if we have better problem solving skills, especially in terms of regulation of our emotions, we're more likely to be able to calm ourselves down, to realize what is happening in this moment of crisis. But we need to have connection and social support. People don't really need to feel that they have a place in the world. They don't feel that they have a place in the world. It can be really disconcerting and really jarring for people. We need to have a community. We need to know that our community will support us when we have the issues. But the next two are really important as well. So access to mental health care, but it's really willingness to participate. If somebody doesn't want to or doesn't find it valuable, then they're not going to participate. And we know that their outcomes are not going to be as good as they could be. So there are certain groups and populations that experience suicide risk and those contributors that we were just talking about differently. So one that just came up in a previous presentation that I did is suicide in the perinatal period. According to the Colorado Maternal Fatality Review Commission, in the state of Colorado, a woman who is in the perinatal period, so from pregnancy to about 12 months after birth, has a 2.1 times higher risk of dying by suicide than women who are not pregnant or not in the perinatal period. One of the most risky times is the 4 to 12 months postpartum. And part of the reason for that is because they are no longer getting their routine checks or having their, and so when they go to the pediatrician, the baby is the patient, not the mother. And so one of the things that doctors can really do, or providers can really do, is ask, were you pregnant? Have you been pregnant? And I know that sounds like, well, if she's seeking, I should know those things, right? If she's my patient, I should know that, but not necessarily all the time. And it's also one of the reasons why Medicaid has extended coverage for mothers to the 12-month period, is because we want mothers to be able to access healthcare services. But all of these things come into play too, right? Like relationship status with a partner. Going back to this idea that we have, what is our place right now? And so when you have a baby, and and as some others would both say that it was all rainbows and sunshine and it was the best thing ever. And other times, other mothers will be like, no, it was hard. It was one of the hardest times of my life. The relationship status with the partner changes. And definitely sleep, right? We know that sleep is one of the biggest components to our overall mental health. And you are not getting it as a mom, as a parent. And so then, this is another one, right? If you've lost the pregnancy during that time, health issues, we go back to those chronic conditions or pain, and definitely financial stress. Talking again about why I think in 2020 we saw that decrease. I think that people were able to take care of themselves. Financially having a baby is harder. And so now you've got to take care of yourself, and another came in between, and that's difficult. So we can, have supportive partners or support systems. This is especially true if mom and dad are not close to family. How can we support them better as a community? And then definitely accessing mental health care. So suicide in older adults. Depression is definitely probably either been unidentified or undertreated, untreated or undertreated. At this point, we're getting back to that chronic illness and pain. And this, I want to talk about this loss, right? And we're likely to experience loss than other groups. I don't necessarily mean loss from death, right? So, but yes, we know at this, as our family members age, they might lose their spouse, etc. But we're also talking about retirement, so loss of job. We're talking about, maybe changes to not just their employment, but also to how much they can work. And so when you talk about loss, we really want to look at the larger picture. It's not just a loss from death. And so when we can lose our place in the world, but the things that we thought made us us, it shouldn't be disconcerting for people and upsetting.
Especially losing independence.
Losing independence. Thank you. Thank you. Yeah. It was in my checklist, but I did not get there. So I appreciate that. Yes, losing your independence is one thing that we know it's definitely a risk factor. In veterans, so again, talking about veterans have run a risk factor, a higher risk factor of dying by suicide by 1.5 times than their non-veteran counterparts. We're going to go right back here to here. Readjustment to civilian life, the 12 months after readjustment to transition is a very risky time period for our veterans. And it goes back to that, I knew when I was going to get up. I knew when I was going to eat. I knew what I was going to do. I knew when I was going to sleep. I knew who I was going to be with. And then also the camaraderie and the family life that you get when you are in I'm obviously not in any way military. I don't have any of those language, but you understand what I'm saying. And so when you lose that, it can be difficult to come back to civilian life. We see a lot of homelessness in mental health conditions, but our veterans are seeing things that they may not be able to explain to others. traumatic events that we do not see and have not been a part of. PTSD is real, post-traumatic stress disorder, firearm ownership. So going back a couple of slides where we said that in households that have a firearm, the risk of dying by suicide increases, 3 times higher than in homes that don't. Well, firearms are 70% of veteran deaths. So we can definitely support them by including state of storage of firearms. We have the gun locks in the back. They are great. They go through the trigger mechanism. Definitely increased access of mental health services and definitely transitioning them back into the in life. So our rural communities, can we just, this right here, and that the lack of access to mental health care is nationwide, right? But it can be more acutely felt here, just because we may have providers in particular areas that do not accept insurance. We may have providers who accept Medicaid and they are a very low but constant payer, a consistent payer. And then, we may not have access to specialty mental health services. We know that with just our biomedical access for services. We definitely have the social isolation. I don't know if anybody has read the Surgeon General's report on isolation. It's really eye-opening what isolation does to your body and how it ages you and is a risk factor for early death, not just by suicide, but for all conditions. Socioeconomic factors, the difficulty of finding and keeping a job. We know it's difficult here in our small county to be able to find a job that supports you and your family, if you don't necessarily have a college degree. And that these may be at the whim of somebody else. But if you are here, right, if you are raising cattle, if you are, on the Eastern Plains, when if you're raising corn, do they raise corn? Well, and I'll wait for this too. Never mind. Okay, I got it together. But if this happens to you, right where we have drought or a flooding or something like that, and your entire ability to provide for yourself is built on this thing that can be taken away on a whim, that can be very anxiety provoking. We're going to talk about camp, and then in a couple of slides, it's a great program that really tries to help our populations that are working in agriculture and those industries. And again, access to firearms. A lot of people in our area have firearms in their homes. They hunt, they may sport shoot, etc. So when I talk about access to firearms, I want to take some of the politics out of it. No one wants their firearm to be used to shoot a person. They really don't want it to be used to shoot themselves or someone in their house. So when we talk about access to firearms, we keep that in mind. We need to really try and figure out how to bring some more connectedness. Yes, that comes with its own kind of problems, because then everybody knows your problems and everybody knows what you're doing, because everybody knows your name. But at the same time, if we can kind of revamp that idea of what connectedness in a rural community might be, that could be beneficial. And also another thing too is really highlighting the idea of telehealth for mental health services. It's not going to work for everybody. It necessarily work, even the first time, but giving that as an opportunity. So really, talking about construction workplaces. So one of the highest suicide rates. So heavy workload, working long hours, access to lethal means. It may not be necessarily access to firearms, but and more the access to those lethal means. Chronic physical pain and our energy, injury, culture of stoicism and toughness. Right, my dad is a carpenter. He's been a carpenter his whole life. some of the injuries that he has gotten, well, he's retired now, had, gotten while he was working in construction, you'd be like, oh my gosh, that happened. And, and then obviously chronic physical pain leads to possible opioid and other substance use issues based on the fact that I have to go to work, right? This is my family's main source of income. I have to go and do this. So I'm going to go and maybe use an opioid that I wasn't prescribed from a year or whatever. The cyclical work periods where I'm going to work for the 5 months of the summer and then I'm off for a while. Am I getting my unemployment? Am I able to take care of my family? That cycle of that anxiety-inducing lifestyle. So there is a break program through Sally Spencer Thomas that has become her focus. Look her up, Dr. Sally Spencer Thomas, about instruction. So really fostering communication within the work environment that, yes, your mental health is part of your overall health, and you may have to have a sick day. That sounds crazy, and you're somebody in construction. I know, sounds, and respect, right? So feeling some level of autonomy that I'm able to actually take care of myself, and I don't have to work solely at the whim of my employee. That's hard. Okay. So these thoughts of suicide are really complex, right? When we talk about these things, our brains are kind of wired to always want us to live, but there are these other feelings and ideas that are percolating in the back that doesn't want them to. And then we also think about this idea of burdensomeness. If I feel like I'm a burden to the people around me, what's one way for them to be unburdened? For me to not be here, right? So if we think about that kind of as that next step, I've been having these issues, I've been having this pain, I haven't been able to go to work, my family, I'm not able to support my family. My family might be better off if I'm not here, because then they won't have me as a burden. And they definitely may feel overwhelmed and hopeless. So a person in crisis, we have to think that this has been going on for probably a very long time. There's very few instances of somebody who does, and I can't believe I've been sensing that I've been saying instantaneous suicide, where somebody has never thought about suicide before. It comes into their head and they do it right away. They're very conclusive like that. For the most part, this is something that they have been living with for a very long time. They've been living with this mental anguish and pain. I don't use those words lightly. They've been living with that for a really long time. And so what starts to happen is that their thinking starts becoming constricted. And so we would say it's kind of like a tunnel vision, where the only thing that they can really think about is how much pain they've been in, all the things that they tried to fix it, and those things that haven't worked. And then they start thinking, well, this might be the option, right? Because that's it. I've tried everything that I can. And so this is the only way that I can think about it. So that's when they lack flexibility. They can't really see outside of that tunnel. And so they can't, so if you can't think outside of the tunnel, you can't access any of those coping skills, right? And of those things that you may have used in the past to be able to calm yourself down, bring yourself back, make yourself realize that this is just a moment. And it's not a choice to feel this way. And I know that sounds kind of, for those of us who have never really had a suicidal ideation or thought, but this really makes sense to them, right? It's not a choice that I feel this way. I have had years and years of battling this on most of the time alone, thinking that I'm the only person who's been going through this. And it's not a choice at this point. That tunnel vision is so tight that it isn't a choice. And it makes sense. It makes sense to them that this is the next thing that I'm going to do. So, but the good thing is that most of those thoughts of suicide are temporary. And what I mean by that is, if we can keep give somebody some time and keep some distance from them and their lethal means if they have access to them, we can really get them to go get out of those critical moments. I shared in the afternoon session that I had a panic attack on November 11th, and I came to this fine establishment after the AMTs came and got me off I-70 after I had been driving for at 80 miles an hour. Yes, I was speeding. It's fun. And I mean, to the point where I had claws, like my hands were unable to unclench from the steering wheel. I was very I love Siri, you guys, because I was able to tell Siri to call 911. And, but the moment was temporary, and, the repercussions of that are I'm working my anxiety issues, really working on some somatic things, best to all know that, but it was temporary. But at the time, it didn't really feel like it was. But we can get through those critical moments. So the ways that we can do that, we can watch for our warning signs. We can have a conversation, reach out to our friends, talking about, in 2020, keep the environment safe, and then connect somebody to help resources. So, warning signs. These things need to come together. So what I mean by that is we want to listen to the way that somebody is talking. We want to look at their behaviors. And then, do they have mood? And what I mean by that is everybody who has been a teenager or has a teenager or had a teenager has at one time or another heard their teenager say, if I don't get asked out tomorrow, I'm just going to die. Or if I don't get that A, I'm just going to die. So we have to talk, right? We have this talk, but we may not have the behavior, right? And so what I mean by that is I'm saying things like, I'm a burden to my family, and I'm sleeping 14 hours a day. Or I'm using drugs or alcohol. Or I've increased my use of drugs and alcohol. What we would really say is that there is a major change in someone's behavior from what they were before. And so, your friends and family better than, and if you can tell that they have changed their behavior, that is a warning sign, because their brain is trying to make them feel better. And that's what our brains are wired to do, to make us feel good, to make us feel better. And so they have found a coping mechanism. Sometimes it's what would be considered maladaptive. And so they start using drugs or if they have been just a social drinker before, and they're drinking every day, and they're drinking to blackout. And they're acting recklessly. This is a big one for our area. And I know you're kind of like, what? What do you mean? So if you start engaging the pathway to suicide, you have to kind of work up to it. It's not something, as I said before, that happens instantaneously. You have to kind of test yourself to be able to see if you can get to the line. And so if you start, really acting recklessly in terms of your, skiing or, your rock climbing or other things, or driving unsafely, that's that acting recklessly, because you have to enjoy your brain. Even though you think that this is the only way for things to get better, you still have to work up to the idea that then you can get your life. Definitely isolating from family and friends goes back to the privacy issue. Looking at this giving away of possessions, we used to, does that really happen? Yes, it really happened. Missing work, right? And so then we also have to have the mood. Rage and irritability is really a big one for men. Depression and bin can come out as anger, more than it does, the apathy or the inability to really engage with life that can happen. That's usually for women. And the big one that is here is the sudden unexplained happiness. We call this the mask of suicide. And what has really happened is that somebody who is on this path of suicidality that's finally acquired meetings. They have their plan. They have committed. They understand what's going to happen. And so all of that weight of that pain, that anguish that they've been in, is lifted. And so now they're suddenly happy because they know that things are going to get better. So what do? Well, trust your instinct. If you feel that somebody may be doing, you've got all of those, you've got those warning signs, trust your instinct that something may be wrong. And always assume that you are the only one that's going to reach out to that person. You are the only one. Because that way, if you are the only one, then you have reached out. And then this is one of the hardest things that you will ever do. It is awkward. You're going to think, I don't know what to say. I don't know the right words to use. Be okay with that. You've got to be okay with that. And simply asking questions and being part of the conversation is better than not saying anything at all. And so then before you reach out, you got that tunnel vision. You can't fix it. I want you to understand that you alone can't fix it. What you can do is ask questions, but don't approach the situation, with the idea that you have so much to live for. Well, that person doesn't think that. That goes back to that inflexible thinking of before. And I just want you to understand as a peer, as a person, that you do not have the tools or the expertise to fix it. But you can be the first front line and saying, okay, well, I am worried about you. This has been happening. Let's talk about it. You want to ask open-ended questions, and you want to listen. You want to probably listen more than you ask questions. You want to show empathy and support with your words and body language. So you want to do this in private. You don't want to do it in a public place. You want to turn off your phone. You want to make sure that you don't have any distractions. So, if you're worried about a mom friend who has kids, maybe take them to the bathroom. I know that probably they'll still be knocking on the door, but it might be a little bit better than just asking them in front of their children. And then listen for those warning signs, right? We want to make sure that we are showing our full attention to this person, because this is an important conversation that for both of you. And then going back to, one of our first slides, we need to be using concrete language. We need to ask directly. Now you can start with, sometimes, people are going through something like this. They might think about hurting themselves. Have you thought about that? And then you really need to ask, are you thinking about suicide? And I bet it's hard. It's hard. But we need to have those concrete, we need to have the concrete language and concrete ideas about what is happening. And most of the time, what we know is if you ask somebody if they are thinking about suicide and they are not or have not, it will not put the idea in their head. But if they have it, and maybe the first time they have ever had somebody in this loneliness that they have been in actually say the words to them, and it might give them an opportunity, and then maybe send the to them. So if they're not thinking about suicide, just really continue to support. How can I, are you seeking out services? Can I help you find a provider? Can we go on a walk, or, can we go and, how can I help you from this point? If they are thinking about suicide, you need to keep asking more questions. You need to figure out if they have the plan, if they have the means, if they are committed. Because you begin, going back to the concrete language and the other questions, the more information you have, the better prepared you are to help them. And so then the next steps, I think this is really important. Just think about how awkward it is for me to talk to you about this, and we are just talking about this in a conference room. It's really awkward. It's really hard. It's really neat to thank somebody for opening up to us and saying, yeah, things are really bad right now, and I have been thinking about this, or even if they haven't, but thank them for sharing with you. It's hard. It's hard for us to open up and be vulnerable, and if they're willing to do that with you, thank them for the privilege. It is a privilege for somebody to share with us. Connect them with the resources and stay in touch. Okay, we're going to watch a long birdie. Then, Jessica. Okay.
Who's the picture?
I can.
Dad? Are you okay?
Yeah, just stressed out.
Oh, and the melody is sounding so much better. I can play it for you. Wait, where's your guitar?
I gave to your cousin.
What? The guitar's like your favorite thing.
I don't need it anymore. That is good. Oh, something's yes. Or just
I think you should go talk to someone.
it's not that easy.
Have you been thinking about suicide? You can talk to me, Dad.
Oh,
And so the reason that I like that video is because it kind of shows those previous slides make it seem as though this is kind of an immediate thing, right? Like, oh, we're going to go to A, and then pick up B, and then we're going to go to C, and that's not necessarily how it happens, right? And so, granted, it's a short video, but it really does show that the daughter is really paying attention to what's happening in the father and his mood and his language over a period of time. So it's not like I recognize this on a Monday, and by Friday we've got you into services. That's not how it happens, but for most people. So I like that again. Okay. So really truly the most important thing you can do for the person who's thinking about suicide is time and distance. And so we know that there's about a 5-minute window, usually, when somebody is committed in healthy means before they actually do the act. If we can notice the warning signs and we've had a conversation, we may be able to interrupt that even more quickly, right? And better than somebody who may be in a crisis and need for de-escalation. So help them limit their access to the lethal means. Remove or secure your firearms. This is a big one, I think, for here. Just because there are transfer laws in terms of a firearm, you can't just, you can, but legally you are required to sign paperwork if you give your firearm to somebody else. But you do not have to do that for ammunition, and you can store it separately. Secure your medications, secure the toxic substances. Somebody asked me, a friend asked me, well, what if you do those things? Aren't they going to find another way? And it goes back to that tunnel vision. This is the only plan that they had, usually. And what I mean by that is if they have thought about using a firearm as their means, if you interrupt that, more likely than not, that tunnel vision doesn't allow them to expand or to change the plan. But the best other things that you can't do is definitely ask what they might need to feel safer. Make them part of this conversation. They need to have ownership, just so as we talked about earlier, about their willingness to be part of their mental health care. Having them be part of keeping themselves safe is very beneficial. We've already kind of talked about this. Yeah, most firearms. This is a really important one. And I know that most firearm deaths in the United States, and this includes, mass shootings, includes homicides. Most firearm deaths in the United States are suicide deaths. All right, so with under conversation, we made the environment safe. Now we want to get them the crisis resources. You want to dial 988. And the reason for that, even though we do have on local mobile crisis services service in the Aspen Hope Center. And if you've got a 988 and you need, there is a need for mobile crisis services, 988 will then direct to Aspen Hope Center to get somebody out. And so we want to keep the lines open. At one point, I think Colorado Crisis Services said 65% of all the calls that they receive only need that 15-minute call. And so we want to keep the phone lines open for the mobile crisis services that are offered by Aspen Hope Center open for those mobile crisis call-outs that they might need. You can text 988. There's number 1 for veterans, number 2 for Spanish. The crisis text line is still available. Are you with that? 741 for Spanish. Help the person get to emergency services if they haven't yet been injured. Trevor Project for our LGBTQ youth, and then the trans life. You can always call 911 if somebody is actually has been injured or if the threat of injury is imminent. And then, we want to connect to professional care, right? This is just ways for people to find mental health services. We do have a good resource for our area, Psychology Today. West Mountain Regional Health Alliance has a resource page for mental health services. We know that Grand River, Valley View, Mountain Family, Mine Springs, all of those are available. Make sure that you get an evaluation, right? As we kind of talked about, for most people who are having suicidal ideation, this may be the first time that they actually ever get linked to mental health services. So you want to have an evaluation of what actually is happening for what you are going through. Continue treatment, follow-up. There are so many barriers to receiving mental health care. One, just a shortage of providers is just one of those things. Practice some self-care, connect with your loved ones. This goes back to finding your place again. Somebody who has been isolated for so long by this pain and anguish, reconnecting and getting back into your community and knowing that your loved ones will be there for you. That is important. So here are local resources, primary care clinics, behavioral health service, Settles Mountain Family, Valley View, Mine Springs, Pathfinders, which is grief support. And they work throughout Garfield County, a way out for substance use. They are amazing. If you have somebody who is really wanting to get clean and sober, and they can't find a program locally, they will pay for you to go someplace else. Headquarters, they have resources and other mental health services, and then emergency department. So I wanted to talk about camp. So the Suicide Prevention Coalition of Garfield County, along with our sister organization, Speak Up, Reach Out, which is the Suicide Prevention Coalition of people are going to be bringing camp individuals here. So CAMP is the Colorado Agricultural Addiction and Mental Health Program. It is triad for people who don't have triad. So they offer 6 free sessions for individuals. And the best part is definitely ag friendly. And so, either the therapist is living or working in an ag environment, or are part, they themselves have been on ranch or other things. And then the remote availability. So we know that somebody who is, working and living on a ranch, they don't have a day off. And taking 4 hours out of their day to be able to come and get a therapy appointment that's not going to happen. So there is that remote and telehealth availability. And the reason that I'm really talking about this is because I worked with someone who was a therapist, who was a camp provider, and has been for a while. And in that time, we've only had to train people, and that's like one every year. And it's a free service that's offered through the Department of Agriculture as well as the Farm Bureau. And so there are cards for that and that. Then post-fiction. So this is what we really want to do after a suicide loss. We really want to get people put into resources that may help them. As I said, we have healing conversations. There are cards for that in the back. You would contact AFSP, and then AFSQ would link you to the person that we have trained here in Garfield County to provide you that peer support. And then there's other resources for suicide loss survivors. And so, you know, we all need to really kind of prioritize our own self-care. We need to really think about how are we caring for our minds, caring for our bodies, our souls, and then our surroundings or our community. I'm not going to make you write anything down, but we all know that if you don't you have to take care of yourself first to be able to take care of those around you. You have to put your oxygen mask on first, so it's really important that you prioritize those for yourselves. Okay, we have one more video.
When I was a child, I always felt as if I was different. In high school, I did come out of my shell a bit, but with that came party and the alcohol struggle. Episodes of mania, depression. Going off to college was not the right thing. Went to a party one night, and I just remembered feeling there's no point in going with friends and living in it. And that night I decided that I was going to take my life. When I got the impulse, I acted on it. When I got loaded, I told no one. I picked up some jobs that I'm better job about. I did meet my wife, and we had a couple of boys. The self-esteem started to rise, and the confidence started to go up. We had a life together. As I moved forward and got older, our children got older, these episodes started to intensify again. And they were getting worse. The depressions were lower. Mania was higher. And that brought on being alcohol and the drugs. That's when I was first diagnosed that I was living in bipolar disorder. My brain wasn't thinking straight, wasn't thinking correctly. But it was like there was a voice telling me my life, and all of it was fake. But none of it mattered. And it was light, but I believed whatever it told. And so I planned by attempt. I thought the plan I had was foolproof and work. If it. When I was in the hospital, receiving treatment, I woke up and looked at myself pretty hard and said, it's not. And this tip is so. Can't live this way even more. That was the moment I realized that I needed to start on to recovery. I had to stop drinking, and I had to stop taking drugs. Another key thing for me was embracing professional life. As far as tools I was given, it started with running. From running, I found yoga. I met a group of people that embraced and will support me. And I, in turn, supporting that. Actually, recovery is complex, and there is no one answer for everyone. Find what works for you. Recovery is attainable. and the company families. And on to the poop.
And so again, I'm glad that Greg can share his story. But as you can see, all of the things that we talked about, all the things that we have shared, are all the things that he has gone through. So, we really do want to create a culture where mental health is, as talked about as our biomedical health. I say those, most people are like, why do you say it like that? Because your brain is part of your body, but it's also physical. So is your brain a part of your physical health? So anyway, that's just something for me. But just because if we can prioritize those things, then suicide prevention will be one of those things that we do, just like we do anything else. Cancer prevention, high blood pressure, hypertension, diabetes. All right, if you wouldn't mind, can you take a minute I'll let you all scan the QR code. Let us know. So, the research into these presentations is ongoing. And so your feedback is very important on that. So there are other ways to prevent suicide. Our local chapter is our state chapter, so it can be difficult to join. But we do have a walk, like I said, the 28th. May 1st, September 28th. And then probably our next Train the Trainer is going to be Soul Shop for Leaders. Soul Shop for Leaders is a faith-based program through AFSP that trains pastors, clergy, and other leaders within congregations on how to bring this into their churches and into their worship spaces, and use it as scriptures to do that. You can sponsor an event. So if you're out there and you want to bring this to your Kiwanis Club or some other institution, you can let me know. And with that, I think we have done. Do we have any questions? No? Perfect. Thank you.
Well, thank you so much. Very inspiring.
And hope you have a great week.
Thank you.
Thank you.